We are announcing that we do have another case of COVID-19 here in British Columbia. That will be our 8th case. This is a woman in her 60s who is visiting family here. She's from Tehran, Iran, so this is another exported case from Iran. She is in the Vancouver Coastal Health Region. There's a very small number of close contacts and everybody is in isolation, so that's good. So she is in isolation at home with a relatively mild case. So we're thankful for that. The investigation is ongoing, but we don't expect to have very many contacts. She is doing the right thing and staying away from others, and certainly was assessed safely in our health system here. The good news that we have is that our first 4 cases have now all fully recovered and are released from isolation and doing well, so that's very good. And our other 3 cases that we've been following are in stable condition, and all of them remain in isolation at home. And many of the contacts of those cases have been finished their 14-day quarantine period, and we have no new cases and nobody with symptoms from those cases. So that's also very good news. I think this tells us that this is a rapidly evolving situation. We're watching it globally, and as we know, there are many more countries now who have more cases. The situation in Iran is one that's very concerning. We certainly are watching that carefully.
And just to say that we are completely supportive of both state authorities in the United States and the United States government in their efforts to deal with this. I think that this is a time for people to come together and support one another.
So we are also preparing for a pandemic, and a pandemic would mean widespread transmission of this in communities around the world, including here in Canada. As I mentioned, though, we are still very much focusing on containment and delaying this as much as possible. We know this is a serious infection, particularly for older people, so that is our focus right now.